just so excited, and I'm so excited about the next gentleman that's coming up, Congressman Ruppersberger. Just has been a real champion. He over and over again on those issues that affect people's everyday lives. And Dutch and I go way back when we were struggling with issues in the city. It was Dutch that would come into the city as county executive over and over again, addressing issues. And when he was county executive, he again did the same thing. And now, as a member of the Congress of the United States of America, he continues to do that. And ladies and gentlemen, Congressman Dutch Ruppersberger.
Elijah, we know what we have to do. First, Matthew and Vinny and all the coalition, our labor friends that are here, it's going to take a team to make sure that we move forward on this issue. The good news is we're coming together early because next Tuesday, hopefully,
yes,
we'll be in a position where we're going to start looking after people again.
Yes.
And that's very important. And we have to talk about how we get to where we want to get right now. Elijah, you took a really strong position on Durante's law, and that was
Diamante.
Yes. And I remember we had a press conference on that, and we tried to get it in the SCHIP bill.
That's
and
right.
that was about a little boy in Baltimore whose family couldn't afford insurance, couldn't afford dental care. He got infection in his mouth, and he ended up dying.
That's right, brain.
Right, and these are the type of things that we're trying to move forward with. I think right now, after this Tuesday, if we can be in a position, we have 100 signed on right now, then we also, though, it's just not about sitting here and we can clap with each other and do what we want to do. It's getting it done.
That's right.
Now, Maryland has a lean, mean delegation. For a small state, we're good. Correct?
Yes, yes.
And it's tight, and we stay together. Even we had the two Republicans in the past stay together. I don't know what's going to happen, but I don't think I have to worry about that anyhow, from what I see now. But what we're going to do in Maryland is we're going to do a couple things. First thing, Maryland has a pretty good system. We still have a lot of uninsured here. But the way our hospital system works, and you heard the doctor talk about it and other people talk about it, we're more advanced, so we can take a lead. We have to talk about how we're going to pay for it. And you want one of the bigger issues of paying for medical care? It's technology. If we can literally let the doctors, the administrators, and the hospitals start taking the lead, and not the insurance companies anymore,
that's right,
we're going to get a lot more done.
Yeah.
You know, how many people out there, how many doctors that you talk to say that they can't prescribe drugs anymore because they're not allowed to do it? They can't keep somebody in the hospital because the insurance companies are the ones that are going to approve it or not approve it. That's not what America, that's not what health care is about. So we're going to try to hopefully take the balance back where it needs to be, just like we're trying to take a lot of balances back. Now, I think we're ready with some legislation right now. We have SCHIP. It's inexcusable that our president would not be able to identify and care about young children that have they have no choice when they come into this world. And if they are in a bad situation because of family situations, because of community situations, America has to stand up for that. And I hope after this Tuesday, I think you're going to see more of that.
Yes.
That's going to be where we need to be. I'm going to close now. We're going to stay as a team. I do want to say I have a passion for healthcare because of personal experience. In 1975, I was in a really bad automobile accident. I broke all sorts of bones. Probably why I'm having another shoulder replacement. I had a lot of 47 pints of blood. I got hepatitis. I wouldn't be here if it were not for Maryland shock trauma. And I was lucky enough to be in the state of Maryland and get into that system. And for 1 month, they didn't expect me to live. Now, I had all sorts of injuries, and I know I had really bad head injuries, and I don't think that ever healed, or I would be apologizing. But I have a passion, and I'm vice chair of the board at Maryland Shock Trauma. I have a passion to make sure other people in our state and in our country, because we're trying to take it nationally, have the same opportunity to live that I did, and to get into a system like that. And because I'm down at University of Maryland Hospital, I'm more involved. Right. Elijah, you have another, John, you have reasons why you're involved. But that's where I'm coming from. And that's where I know a little bit more about the medical. I'm not on that committee, but know about it. So I can tell you right now, and I signed it twice too. I think we all did sign this before. Didn't you have us sign something?
Deja vu, huh?
Yeah. But I think there's excitement. We're going to do it right. We're going to do it smart. Just because we want it doesn't mean it happens over there. You know, it's a contact sport. Right. Look what happened to me. But I think that from now on, We're going to make this a high priority. We're going to take care of our education issues. We're going to take care of our health care. We're going to have good energy, and we're going to take care of people and make them feel good about being Americans.
That's right.